Hey guys, welcome to lecture today. So today we're going to talk a little bit about chapter 15, which talks about the heart. So the heart is essentially a pump in your body that will allow the blood to flow through to different tissues. So it'll pump the blood to different tissues. And that's very important because the blood carries many different things, including different molecules and nutrients that allow different cells to gain energy so they can do work. It also allows for oxygen to be transported. So you'll have these protein inside of the blood called hemoglobin that will allow the transfer of oxygen to different tissues or picking up oxygen from different tissues. So the heart is a very important organ, if not the most important organ. So you're in for a treat for today's lecture. So you can see the location of the heart. It's behind the rib cage, looking at that fifth intercostal space is where you'll see it begin. So it's a little bit towards the left side of the body, but it does cross the midline. So looking at the structure of the heart, you can see the heart has fibrous pericardium. So it's just a layer on top. You can see there's the fibrous pericardium, and then there's also the serous pericardium a little bit below that. So looking at the heart, looking at the walls of the heart, this is the layers of the pericardium. The parietal layer, the visceral layer, a lot of fat, and the pericardial cavity. So this will just help you understand how the heart is structured and a little bit about the material of the heart. So here we go. This is the very important part. So understanding the structure of the heart will allow you to understand how the blood flows through the heart. So there are four hollow chambers. So you can kind of see these four chambers smack dab in the middle of the heart. So you got the atrium right here on the top left. So the right side of the heart, you can imagine if we're looking at somebody, our left is their right. So we're looking at the right side of the heart, which is the left side of our screen. So that's the right atria, right ventricle, then we have left ventricle, left atria. And those are like the main main chambers that will allow you to understand how the blood flows. In between each chamber, we also have valves. So this will allow for the valves help are kind of like a channel for the blood to flow through, and they can kind of limit the amount of blood that flows through. So the walls of the atria are not quite as thick as the walls of the ventricle because the atria move blood only a short distance. Ventricles receive blood from the atria and pump it to the lungs. Specifically, it's pumped from the right ventricle. So you can see the blood will come in to the right atrium, and then it'll go to the right ventricle, and then it'll go right out here through this pulmonary artery. So you can think you have these different blood vessels. Some are veins, some are arteries. You can think of veins as blood vessels that will allow blood to come towards the heart, and arteries as blood vessels that send blood away from the heart. So this left pulmonary artery and right pulmonary artery, they receive blood from the right ventricle, as I mentioned before, and then they will send blood out away from the heart towards the lungs. So left pulmonary artery, pulmonary means lungs, artery are, again, we said arteries will send blood away from the heart. As I mentioned before, the heart has valves, and these valves are made up of little flaps of tissues called cusps or leaflets. So there are two atrioventricle valves which regulate flow between the atria and the ventricles. And there are also two semilunar valves which regulate flow between the ventricles and the great arteries. So the right AV valve is also called the tricuspid valve because it has 3 leaflets. This prevents backflow from the right ventricle back to the right atrium. So as I mentioned before, it kind of regulates the blood flow so that it doesn't go backwards, it's flowing in one direction. The left AV valve, also called the bicuspid valve because it has 2 leaflets, or the mitral valve, prevents backflow from the left ventricle to the left atrium. The semilunar valves are the pulmonary and aortic valves. So the pulmonary valves prevent backflow from, you guessed it, the pulmonary artery to the right ventricle. The aortic valve prevents backflow from the aorta to the left ventricle. So now we can talk a little bit about the blood flow of the heart. So initially, the blood will flow in to the right atrium from the superior vena cava and the inferior vena cava. So remember what I said about veins being having blood flow towards the heart. So this blood is deoxygenated. So this is blood without oxygen, and it's coming from different tissues. So from there, it will flow from the right atrium as the blood pumps to the right ventricle. So we still have deoxygenated blood, and we talked about it before. From there, it will flow out towards the lungs to grab oxygen. So you can see step 3 in this picture, the blood is flowing from the right ventricle to the lungs to receive blood. And following picking up blood, you can see the blood is red now. You have the pulmonary veins, so not arteries, veins. So the blood is coming back to the heart. From there, the blood will flow into the left atrium. It's squeezed in the left ventricle, and then it will go out of the aorta, and this is all oxygenated blood. So we measure, this is actually very important because in the left ventricle, we measure a lot of parameters that allows us to understand the health of the heart. So one of these parameters is the amount of blood that flows out from the left ventricle. It can kind of tell you how well your heart is pumping blood, but we'll talk a little bit more about that in a moment. So just like other tissues, the heart actually needs blood flow for it to get nutrients and work, and not just for it to pump blood in different places. So the heart has its own vascular system, the coronary circulatory system, circulation, that keeps a constant supply of oxygenated blood. So coronary arteries deliver oxygenated blood to the myocardium. The cardiac veins collect deoxygenated blood. So the right coronary artery supplies blood to the right atrium and part of the left atrium, most of the right ventricle, and the inferior part of the left ventricle. The left coronary artery supplies blood to the left atrium, most of the left ventricle, and most of the interventricular septum. This artery branches into anterior descending and circumflex arteries. So again, it's supplying the heart with the blood that it so very much needs. So the heart actually contracts a lot. So cardiac muscle is very important. Cardiac muscle contracts just like skeletal muscle, and the heart has contractions based on electrical impulses that take place called action potentials. And the action potentials are based on essentially ion channels. So we talked a little bit about ion channels in chapter 4, I believe. It was one of the earlier chapters, but essentially the flow of an ion across a cell membrane will change the voltage of that cell membrane. And you don't need to know the nitty-gritty about that, but that change in voltage is a signal for contraction for the heart. I'm greatly simplifying things, but that's pretty much what you need to know about it. So when that action potential triggers due to enough of a certain ion traveling, this causes the release of calcium from the sarcoplasmic reticulum. The calcium binds with troponin on the actin filaments and a cross bridge forms, essentially causing contraction, right? Other than that, the cardiac muscle differs structurally and physiologically from the skeletal muscle. Cardiac cells are short, fat, and branched. Each cell contains usually only one nuclei, just like most cells. So now we're going to look at cardiac conduction. So essentially what I just talked about before, these electrical impulses that will cause the contraction of the heart. So going into the cardiac conduction, the heart contains special pacemaker cells that allow it to contract spontaneously. So because the heart beats regularly, it is said to have a rhythm to it. So the electrical impulses generated by the heart follow a very specific route through the myocardium, through the heart. So the normal cardiac impulses arise in this, the SA node, the sinoatrial node. So this number 1 right here, shown in gold. So an interarterial bundle of conducting fibers rapidly conducts impulses to the left atrium, where and both atria contract. You can see that in yellow. Soon the impulse enters the AV node. It slows considerably to allow the atria time to contract completely and the ventricles to fill with blood. That is, if someone has a regular heartbeat. We're not really going over irregular heartbeats currently, but if someone has a regular heartbeat, it slows down a little bit so that they can have time for that chamber, the ventricles to fill with blood. So again, it'll pass to that AV node, and after passing that AV node, the impulse picks up speed a lot, and it travels to the bundle of His. This is also called the AV bundle. You can see it in purple. So it travels down here. The AV bundle will branch off to the left and right, and it'll give like a huge electrical impulse. So we usually monitor these electrical impulses with an EKG, and I'm sure some of you are familiar with it, but there's a specific rhythm to how the heart pumps based on the electrical impulses that I just mentioned before. So you can see there is a P wave, right? There is a PR wave, there's a P wave. There's a PR interval, so the space from the P to the R. There's a QRS complex, ST segment, and then also a T wave. So you're going to want to understand, and you're going to want to understand how to interpret a diagram like this. So an electrocardiogram that has a normal rhythm is called a normal sinus rhythm. So this is a normal rhythm. In a regular heartbeat, it is called an arrhythmia. So the P wave represents atrial depolarization. So remember what I was talking about when these electrical impulses due to traveling ions take place. So that's what they mean by depolarization. So it is the transmission of electrical impulses from the SA node through the atria. This occurs right after the atria contract. So the PR interval represents the time it takes for the cardiac impulse to travel from the atria to the ventricles. Remember, there's a period where it slows down to allow the blood to flow through the ventricles. And then you have the QRS complex, which represents the ventricle depolarization. So the spread of electrical impulses through the ventricles, that large spread of electrical impulses that we saw before, that's what the QRS complex is. And you can kind of guess that because of how big the signal is in comparison to everything else. The ST segment represents the end of the ventricle depolarization and the beginning of the ventricle repolarization. And the T wave represents ventricle repolarization. So the cardiac cycle essentially consists of systole and diastole. So this is when systole, like, think about it as the blood is flowing through your system. So the blood is flowing through your system. That's how I think of it. And that's pretty much when you're contracting. So think about the blood squeezing, the heart squeezing so the blood can flow through the whole body. And diastole is when the heart is relaxed. So the heart is actually filled with blood. So they're opposites, right? Systole, contraction, diastole, relaxation. So this is just more review of stuff we already talked about. So talking about the cardiac cycle, the cycle of blood contracting and then relaxing. So in phase 1, passive ventricular filling, the returning blood fills to the atria, that deoxygenated blood that we saw before. Pressure goes up, the AV valves open and flows into the ventricles. The P wave appears on the electrocardiogram, marking the end of atrial depolarization. So this is the beginning, and you see that P wave. The second phase is when you have the AV valves open, semilunar valves are closed, the atria contract, squeezing and ejecting the remaining blood to fill up the ventricles. So phase 3, the ventricles begin to contract. This is that giant wave that we saw before. The pressure goes up dramatically. The R wave appears on the electrocardiogram, and this is where the first heart sound, S1, can be heard. So this is isovolumetric contraction. And phase 4, ventricular ejection. So semilunar valves open, blood spurts out of each ventricle. Some blood remains, like residual volume. Not all of the blood is ejected out of the ventricles. And the T wave occurs at peak ventricular pressure. And then phase 5, you have isovolumetric ventricular relaxation, and this occurs before atrioventricular valves open and after semilunar valves have closed. So the pressure in the valves decreases. The T wave ends on the electrocardiogram, and the second heart sound, S2, can be heard at this point. So you're going to want to kind of have an idea of when you're going to hear these heart sounds, what that means, and what your electrocardiogram should look like based on based on the sound you hear. So if you hear the S2, then, the T wave ends on the electrocardiogram, kind of correlate it with what's actually going on with the heart pumping. So I talked about different parameters that we talk about to see how well the heart is doing. So I talked about these parameters that kind of determine how well the heart is working, right? So one of these parameters is the stroke volume. So the stroke volume, remember the flow of blood through the heart, right? So you have the right atrium to the right ventricle out to the pulmonary arteries. So they go away from the heart to the lungs, bring them back. The pulmonary veins, bring them back. and it gets into the left atrium, and then it goes to the left ventricle, which will then allow it to be pumped outside to the rest of the body. So the stroke volume is actually the amount of blood that's pumped from the left ventricle. Super important. You definitely want to know that. So another term is the heart rate, which is the amount of beats per minute. So the stroke volume's units is milliliters per beat. So milliliters divided by beat. And the heart rate, another important term, is beats per minute, right? So if you do that math, that little algebra, the beats cross out. So you have, on one side you have beat per minute, so beat divided by minute, and on the other side you have the stroke volume, which is milliliters per beat. So you'll understand the cardiac output is the volume of blood per minute, so milliliters per minute. And that will that's a great parameter to determine how well the heart is pumping blood. There are a bunch of different parameters that physicians use to check on the overall health of the heart. And cardiac output, heart rate, and stroke volume are all very important ones that you definitely need to know. So there are a lot of factors that can affect your resting heart rate, right? Like how frequently you work out, like how your diet, your resting, like your... So there are a lot of things that can affect your resting heart rate. That is your heart rate when you're just at rest, like normal, such as like how frequently you work out, and also your diet, and also even supplements that you may take. So two types of nervous system are very important to understand, like heart rate. Your sympathetic nervous system is like your fight or flight response when you are like perceiving danger, or maybe you're getting anxious in modern times. Maybe we're not in the prehistoric times when we have to go hunt and like attack animals for food. But nowadays, people's sympathetic nervous system may get, upregulated during a test, So when you're having like anxiety or something like that, your sympathetic nervous system will pump because your body is getting ready for action, right? Because that anxiety is telling your body like, we need to prepare for something. So that will increase your heart rate. So the parasympathetic nervous system, one thing I forgot to mention, your sympathetic nervous system is usually driven by molecules such as like epinephrine. So epinephrine will drive your sympathetic nervous system, causing your heart rate to increase. Your parasympathetic nervous system will cause your heart rate to actually decrease. And this is when you're in your like relaxation mode, you're trying to calm back down after being just excited. So this is also stimulated by molecules, mainly the molecule acetylcholine, which will cause your heart rate to decrease. Hopefully all of you, when you're taking these exams, your heart rates are staying very nice and stable. Hopefully you're studying so much that you're never nervous when you're taking these exams. So now we're going to talk a little bit more about the parameters that we discussed a moment ago. So we have the heart's preload. So this is greatly correlated with the amount of blood that'll fill the heart before it contracts. So it's right before contraction. So it's maximum peak diastole, right? So like you have peak filled with blood. That amount, that stretch, that how much your heart can, stretch open and so that blood can like fill in, that is the preload. So the more blood the more it can like stretch or expand, relax and expand, is correlated with the amount of blood that will eventually be, filled. Next is contractility. So this is the force with which ventricular ejection occurs. So like when you contract and then your blood flows through both ventricles, the greater the stretch, the greater the force of the contraction is correlated with the amount of blood that's let out. So we have different molecules and different drugs that can increase contractility. For example, if you guys ever see a cardiac glycoside that increases contractility, that's not something you need to know for this class, but many of you are pursuing the medical field, so it's just something to keep in mind as you continue your journey. Reload is actually the resistance, specifically the left ventricle must overcome to pump the blood out. So how much force does it need to exert to overcome the resisting force so blood can actually flow out? So now we're going to talk a little bit about heart failure, like when the left ventricle falls behind in ejecting blood that it received from the lungs. So the blood kind of backs up into the lungs because the blood we just got blood from the pulmonary veins, and as the name suggests, the veins are bringing back the blood. So if the left ventricle gets backed up, then the blood it's like there's like a lot of traffic. So the blood gets stuck in the veins, and those veins are connected to the lungs. So you can one common theme with left side heart failure is like crackling of the lungs. You can see in this picture like the lungs are starting to fill up with liquid because the veins are not able to successfully get the blood to the heart so that it's pumped away to different tissue. So that's a common theme of left ventricle heart failure. Very important. Shortness of breath, pulmonary edema, and coughing and crackling of the lungs. So in right side, remember how the blood flows where you got the superior vena cava and the inferior vena cava, like pumping blood into the right atrium. So this is when you're getting blood from a lot of different tissue. So if the blood backs up into the vena cava and peripheral vascular system, you'll see like swelling of different tissue. So like maybe an enlarged liver, spleen, pulling of blood in the abdomen, and sometimes you have like lower leg edema and jugular vein distension results. So you might like see like swollen legs. You can kind of see in this picture he just like kind of looks swollen. So that's a huge indicator of right side ventricular failure. So that's all for today's lecture. I really appreciate you guys listening, and I hope you learned a lot about the heart. Okay, take care.